Hello, this is the A to Z Dentistry. U is for ulcer. Hello, this is the A to Z Dentistry. U is for ulcer. This video is created for educational purposes. It is not intended to be a substitute for professional dental advice, treatment, and diagnosis. Background. According to the NICE guidelines, National Institute Center of Excellence, about up to 25% of the population suffer from mouth ulcers. The project goals are: what is oral ulcer, how knowledge can help, and dental prevention. So one may ask, what is an ulcer? An ulcer is a painless sore that can occur anywhere in the mouth, on the tongue, on the lips, on the cheeks, or on the gums. The causes are: it could be due to minor injuries, such as a biting the cheeks. So some people have got a habit of biting their cheeks. So if you bite your cheeks, it can lead to an ulcer in your mouth. And also, some people, when they have braces fitted, at times they may have a scratch from the brace, or dentures. If you've got a denture that is rubbing, that can also lead to oral ulcer. And there are times there could be nutritional deficiencies, for example, iron, folic acid, or vitamin B12. And if you don't know, stress can also cause ulcers. So at times when you are very run down or you are experiencing hormonal changes, you may end up with multiple ulcers in your mouth. And also some people may be allergic to citrus fruits or certain spices that can lead to an ulcer. And there could also be underlying health condition, for example, irritable bowel disease. So what are the signs and symptoms? So one of the signs and symptoms may be pain. We have minor ulcers and then major ulcers. Minor ulcers may heal within a week or two. Major ulcers may be larger and may take a longer time to heal. But if you find an ulcer in your mouth that has not healed for more than 2 weeks, and you need to seek medical attention, you need to see the doctor who may refer you for blood test, or a medical personnel who may decide to do a biopsy or ask questions about your lifestyle, your social history. That is why when you visit, we ask you questions about your medical condition, because there are certain underlying medical conditions that can lead to mouth ulcer as a side effect. If you find an ulcer on the lateral border of your tongue and it's got red and white patches, you need to seek attention. And always remember, these minor ulcers clear up by themselves. But if they don't clear up after 2 weeks, you need to seek medical attention. There are times you may have cold sores on your lips. It may be due to herpes, or it may be due to radiation or anything like that, or biting your lips or being run down. So always mm, try to find out what is normal and what is abnormal. You are with yourself most of the time. So if you find anything unusual, it is very, very important to seek medical attention. And it is also okay to examine yourself to look out for any ulcers that you find. As I said earlier on, if you are run down, you may break out in ulcers, and you may find it on your tongue, on your lips, on your cheeks, on the roof of the mouth, on the gums. Seek medical help. At times, people go to the pharmacy to buy some gels to protect it. Others use whole salt mouthwash. Others change their diet, because at times, if you are not eating right, balanced diet with the right vitamins and the right nutrition, it can sort of give you that sort of rundown feeling and ulcers. Prevention is always better than cure. Always try and maintain good oral hygiene. And how do you do that? Like brushing twice a day, limiting sweet to meal times. If you're in the UK, you can download the NHS Food Scanner app onto your phone. You can do it now. Go to App Store or Play Store. It tells you how much sugar in the food. So the best time to eat sweet is after meals. If you are having any drink, use a straw and also look out for triggers. So if there's a particular food that you eat that causes the ulcer, try and list it down so that you try to avoid that food. And also try and look out for what is normal and what is abnormal. And also try to find ways of managing stress because when people are stressed or feeling run down, they break out in ulcers. Some people do not talk about their problems and they end up internalizing it and end up clenching or grinding or hurting their cheeks because of the stress they are experiencing. So, for example, if you grind your teeth at night, you can go to the dentist to provide you with a soft bite guard, which is custom made, which is something you can wear at night. And also having a balanced diet and try and seek medical help if you find anything unusual because you are with yourself 24 hours and you know what is normal and what is abnormal. So whenever you go to the bathroom, try and check your face, feel your face. Do you feel any lumps? Do you feel anything unusual? Look at your lips. Do you find any ulcer getting bigger in size? Do you feel anything unusual? And seek medical attention. Conclusion, please share the knowledge and please subscribe. Thank you for staying to the end and thank you for listening. Know what is normal and what is abnormal. So whenever you go to the bathroom, try and check your face, feel your face. Do you feel any lumps?